All right, before I even go in, I'm going to go ahead and check my orders, make sure that I'm going into the correct patient's room. Okay, I'm going to knock. I'm going to go ahead and provide privacy. Hand hygiene. Hi, my name is Leah. I'm going to be your nurse today. The doctor has ordered some IV fluids and an antibiotic, so I'm going to go ahead and get that started for you. Can I get your name and date of birth? Okay, perfect. Do you have any allergies that you know of? All right. Okay. I'm going to hand hygiene. Then I'm going to go ahead and get some gloves ready. I'm going to find a vein I want to use, apply my tourniquet, and feel around. Okay, I like that one right there, so we're going to go ahead and use that one. I'm going to go ahead and prep it with ChloraPrep, rub it for 15 seconds. Okay, I'm going to let that dry while I get my supplies ready. Okay, I'm going to put my tourniquet back on. Get my needle out. Lid, loosen my catheter a little bit. Okay, I'll go ahead and pull the skin taut. Insert as close to the skin as possible, bevel side up. Insert. And insert till I see a flash. Okay, so I got my flash. I'm going to go ahead and advance the catheter until it's flush with the skin. Go ahead and put some gauze under here. Go ahead and pull my tourniquet. Here. I'm ready to go. Go ahead and pull my needle out while occluding the vein. Go ahead and put that in my sharps container. Pop the lid off that. Okay. I'm gonna pull back, check for patency. And then flush, everything's going in nice and smooth. Let me throw that away. Go ahead and tape this here. Get this stuff out of the way. I'm going to take my Tegaderm. Directly in the center here. And I'm going to go ahead and label an initial per agency policy and put that right by the IV site. Okay, I'm going to throw this away. I would change my gloves, perform hand hygiene, put a new pair of gloves on. Go ahead and get my fluids ready. Go ahead and turn this on here. I'm going to check my bags, make sure there's no holes, everything looks all right. I'm going to take my new tubing. I'm going to spike and prime my bag. I would not have dropped that. I'm going to go ahead and, maintaining sterility, spike the bag. Make sure this is closed. Go ahead and hang my bag. Okay, that's closed. I'm gonna fill that halfway. And then I'm gonna go ahead and open, prime my tubing, making sure there's no air bubbles. I'd flick it if I need to. Okay, everything looks good. Go ahead and pop this in here. Get that closed. The order was for 400 milliliters of saline over 4 hours, so I'm going to go ahead and set my infusion rate at 100. I'll set rate to be, volume to be infused at 390, so it goes ahead and beeps, so I have a little bit of time to come and make sure everything looks good. Okay, and then I'm going to go ahead and clear my volume infused. I'm going to go ahead and scrub the hub 15 seconds on both sides. Go ahead and attach that there. And go ahead and hit run. And now I'm going to go ahead and get my piggyback ready. Again, checking the bag, making sure there's no holes. Everything looks all right. I'm going to go ahead and spike, maintaining sterility. Make sure this is closed. Okay. And then I'm going to go ahead and hang my bag and prime it. Make sure there's no air bubbles, flicking if I need to. Go ahead and make sure that's closed before I hook it on. Okay, I'm going to hit hold. Go to my secondary. I need to run 50 milliliters of the antibiotic over 30 minutes, so I'm going to go ahead and set my rate to be infused at 100 milliliters an hour again. Volume to be infused is going to be 50. And then go ahead and hit enter there. I'm going to scrub both my hubs for 15 seconds again, and then attach here. And then go ahead and hit run on my secondary. And then before I leave, I want to go ahead and make sure my piggyback is the one open. Let me make sure that's the one dripping. Okay, everything looks good there. Okay, Mr. Jones, I'm going to go ahead and let these start infusing. If you have any trouble with that IV site, like any redness, any burning, any changes whatsoever that don't seem right to you, if you go ahead and just let me know. I'm going to go ahead and lower the bed, give him his call light so that he can let me know if there is a problem. Go ahead and clean up my station here, and I would have made sure to put my needles in the sharp container there. And to discontinue the IV, I would unhook everything. I'm going to occlude the vein and just pull out the catheter. And again, before I go, just make sure everything's in the lowest position, everything looks good, and he can get a hold of me if he needs to.